You told us a minute ago how you identify. How do you identify?
Yes, I said I identify as a life force.
Tell us more about that. What does that mean?
It means that how I identify my life is actually through action. So this and I'm religious. You know, I believe in God, and I believe that His force comes through me and shines through me to others. And so that actually shows up as actions, not just words. Or it means that you show up for people, you do things that are right and just. And I'm not always perfect at that. I'm not saying that. I'm just saying that it when I wake up in the morning, I think, what's going to be an opportunity today, and what do I want to make with today, this moment right now?
Hi, everybody. Welcome back to the Being in Medicine show. Today we have a very, very special guest. She's actually famous in the Black Hills of South Dakota. Dr. Joy Falkenburg. Welcome, Dr. Falkenburg.
Thank you. I really appreciate that. Thank you.
Welcome. So happy to have you.
And you're you've been practicing for over 20 years, and you practice now in Custer, South Dakota.
Yes, so I have actually been in Custer my entire career. I went to USD med school, and when I went and interviewed at USD, I was probably not the shining example of the very best med student application. But lucky for me, I had some really great interviewers who were interested, and I told them I wanted to go to USD med school so that I could come out to the tri-state area and create a medical care for the people that I loved. And they must have believed in me and let me in.
Well, thank goodness they listened and believed.
No doubt. Yeah.
You told us a minute ago how you identify. How do you identify?
Yes, I said I identify as a life force.
Tell us more about that. What does that mean?
It means that how I identify my life is actually through action. So this and I'm religious. You know, I believe in God, and I believe that His force comes through me and shines through me to others. And so that actually shows up as actions, not just words. Or it means that you show up for people, you do things that are right and just. And I'm not always perfect at that. I'm not saying that. I'm just saying that when I wake up in the morning, I think, what's going to be an opportunity today, and what do I want to make with today, this moment right now?
Wow, that's amazing.
Right now,
yeah. I love that.
That's amazing. So you show up being an expression of divinity wherever you go.
Yeah, I really think that's right. I had this interesting image that was shown one time. I think it was as a meme, but it kind of stuck with me. And it showed a drawing of how some people think of God and how other people think of God. And it had God as a circle and then people underneath it. And the other one stuck more with me, which is like God and then little pieces of God in every single person. And it stuck with me so powerfully, because I thought to myself, if I could imagine the divinity in every meeting with every person in my practice and in the community, how powerful that would be. Like if I could see, even in the person who's addicted to drugs, or who is frustrating, or who is actually being maybe mean to me in the ER or something, if I could see the divinity in them, it means that I could meet them where they were at and nurture that part of them.
Wow.
That is amazing.
Beautiful.
What a remarkable way to express that. I just love that. Thank you for sharing that.
Yeah, you're welcome.
So what does that look like? Showing up and I'm being with you in this moment, and I'm seeing the divinity. I'm seeing the face of God in you. What does that look like?
You know, that yesterday and this morning, I have a dying patient that I went over to his house. And yesterday when I went over to his house, it means that I don't ever abandon somebody. I am not always available. Right now in my life, there are times when I'm not available, but I show up in a lot of different places. That doesn't necessarily just mean my clinic, but it may mean on the street. When I walk past somebody, I see them. I know them. I know their name or I know their story. With this particular individual, it means that I showed up at his house, and even though he was unconscious, as I slipped my hand into his, I said, "Hey, it's Dr. Joy," and I promised I wouldn't leave you. I'm still here. Even in your death, I'm standing here. With that particular patient, I was taught something really wonderful by Heath Waddell, who is a doctor over in Sundance, Wyoming. And he was my resident physician, and then he became my partner. And we worked with dying patients together. And one of the things he taught me was washing my patients' feet to walk with Jesus when they were dying. And it was such a humbling experience to calm myself and bring myself into the moment of washing another human's feet, that I really enjoy practicing that with my patients. And so it means showing up for them.
I just got inspiration bumps when you told that story.
I did too.
Yeah.
Go ahead.
It's been a journey, so I know that one of my younger partners, Connor Weiser, who I really enjoy being near and mentoring, sometimes feels inadequate is not the right word, but maybe a pressure. He'll say something like, "Well, I'm not Joy Falkenburg," and I'm like, "No, because you're Connor Weiser."
Yeah.
And he's like, I don't know how to do some of the things you do." I'm like, "I didn't know how to do the things I did when I was young either." We're all just learning. It's the first time I had a first death of a patient. I had a first error. I had first in everything. And so we just show up the best we can that day. And then we hope that the version of us the next day is a little bit better.
Yeah.
Brilliant. From the way we look at things, it occurs to us that what precedes doing is being. So even when we don't know what to do, we would stand with who we're being, and that will naturally inform what to do from that point forward.
Mm-hmm. And maybe the answer is not that we always know. There are so many times in my practice, I don't know the answer. I don't know the ethical answer. I don't know the answer for that individual. I think a lot of times what happens in physicians is that we want to believe we have all the answers, and it feels so uncomfortable that we don't, that we fill in space and time when we're sitting with somebody. In fact, we either get up and leave, and we're going to find the answers. We're going to order a test or order a procedure, or we're going to move them physically. Like, I don't know the answer, so you need to go to the ER. I don't know the answer, so you need to go see a specialist.
Right.
Whereas I think that if we could be more comfortable with the person and say, there may not be a right answer that universally fits everyone. Can we talk about this together? Like, what are your goals? What are your fears? What can we do to help you? Then maybe together we can be creative about helping them. And if there's not a solution, because we all are terminal at some point, right?
Yeah.
Then sitting with the discomfort of saying, like, I'm still with you. I'm still here.
Right. Wow. Presence. Just having the presence.
Yeah. Tell us more about that, Corey. Presence. What does that mean?
Well, if I could bring up like the healing and wellness garden that you created at the hospital, right? Because to me, it's a location. It's more than just a landscape, right? You created a presence inside that space, right?
Yeah.
And so, who were you when you created that? What was it about you that wanted you to create a space where people could be present to their surroundings? Like, what brought you to that?
So I was raised Catholic, and I'm still Catholic, but there's a part of me that is very interested in other more universal energies, and I think we just use different words a lot of times, to explain the divinity. So when I was probably 21 or 22, I remember somebody using the word prana, and I thought, what is that? And an image came into my mind of my sisters and I walking through the tall grass, And the grass when at the ranch is like, it sways back and forth and it turns brown.
Mhm.
And we would just run our hands along it and the sunlight would be there and my sisters would be laughing. And I just thought to myself, that's my prana. That's my moment of it's a complete being in that moment.
Yeah.
The sense, the smells, and I wanted somebody to not have to be in the hospital
Mm.
and not have the moment to be able to look outside and think of something bigger than that moment, that their diagnosis, their disease, their possibility of death. I feel like it was such a powerful thing for me. I wanted to bring it to someone else. And when I read about it, the T cell function and the lower hospitalization rates, the shorter stays in the hospital with green light, which is the light that's emanated from plants, I just knew that wellness was about something different than just coming to the hospital when you're sick. I wanted people who work there to be well. I wanted the community to be well, and I wanted people to get well quickly who were in the hospital. And I thought nature was the best way to do that.
Oh, that's beautiful. Yeah, it just symbolized to me when I was reading about it. And now I'm going to drive down and experience because I haven't yet.
Yeah.
So just how much that space could create presence for people to be in the moment and to really heal from being present. And I gather, I know about you, and I've had patients of yours, and they always talk about just how present you are with them, how you make them feel heard. And so for me, being present with patients is creating that space to listen to them and to just feel and hear them. And so I just want to acknowledge you for that, because you have so many patients that say that about you.
Well, thank you. It's been a challenge with current medicine, right? So I came into medicine at a time we used paper charts, and we really just sat next to somebody and listened to them and then later dictated that chart. And then I got thrown into a world that I was like, oh, wow, this electronic medical record is not, they put computers in the rooms, which I was like, I don't want those in my rooms, Well, it wasn't really an option. And so my organization, and really like Barb Husband, who works with us, was great enough that I have a team that the girls go in, Jamie and Kaylee, they're just so great. They go in and they kind of tee up the visit with me so that I can look at the chart on the computer and then walk in the room and still sit with the patient. I want to sit next to them, because for me, if I can feel their presence, I can help tease out how sick they are, how sad they are. I have to look at their eyes. I have to feel their skin. I have to feel their energy. And I cannot do that when I'm like looking at the computer. So it's been a real challenge with the way that medicine works. And also just because, you can sound hippy dippy, I don't necessarily, it's not that I don't care what people think. It doesn't influence me what others think necessarily. So we go through a lot of clinic management, and each time I'm kind of explaining myself like, oh yeah, that's not how I practice. And they're like, well, you kind of need to. I'm like, well, I'm not going to. I'm going to do my thing, because I feel like it's a vocation. It's like a calling. And so therefore I need to fulfill what I'm called here to do. Yeah.
It feels like with today's medicine, with the EMR and with just the doings of medicine, we do lose sight of that calling sometimes. And that I think that leads to the burnout that we experience.
For sure. For sure. I think there's so much of our time that is back to back, like no breath time, no time to kind of just let things sit with you to digest them, think about our emotions that things get put to the side and then never really dealt with.
Right.
And I'm not sure that I have the answer for every person. I'm a mentor for med students, and I enjoy the questions that med students ask me, like, how do you think in the future I should, try to stay connected to my patients? And a lot of times you really have to hear them and actively listen. I find the information on active listening very interesting, because I never once took a class on active listening. I listened to podcasts on it. I researched it, but I was never taught that in medical school. And active listening is something you have to practice. You have to really look at it.
Yeah.
So
Absolutely.
I heard something in what you said. You're telling me that doctors have emotions and feelings too.
Isn't that amazing? Yes,
Yeah.
I have big emotions. I sometimes, when I was a younger doctor, I had to realize how those emotions could impact other people, obviously, because at 50, am a completely different physician than I was when I was 28 and 29. And also, like we have lives, right? So
Yeah.
when you're breastfeeding a newborn baby and you have two other babies at home and you're working 70 hours a week and you're short tempered or dysregulated because you've had no sleep, I felt like there was never somebody who said like, hey, here's maybe a way to think about dealing with this or think about um, regulating yourself better or how you can take care of yourself better to take care of others. It just felt like everything was taking instead of anything filling my cup or filling my chi, my life force.
Yeah.
And so we definitely have emotions. We have lives, we have baggage, we have all those things, don't we?
We do.
How do you fill your cup?
This is going to sound pretty hippy dippy. I mean, I fill my cup with my family. I fill my cup with my religion. I go to church. I fill my cup by grounding myself and laying on the ground and watering my plants. I walk barefoot in my garden. I sit in my garden. I have this protected area during lightning storms, during thunderstorms, because that helps me feel like I'm building my life force. I roll all my windows down or take the top off my Jeep and drive down country roads with nobody else around. And sometimes when I'm wild crazy, I like take a pack of Marlboros and smoke like three of them, drink some heavy course, and go dancing. I don't do that very often, but in all reality, like that actually is one of my favorite things to do is be like my original self from Edgemont, which is kind of crazy. And it's not that I would recommend anybody do that all the time. I'm just saying that that's an authentic part of me that I really enjoy is like reconnecting with that Joy Falkenburg, who is like 18, 19 years old.
I love the fact that you said authenticity, because I think we lose the authenticity, or not lose it. We mask it. We mask authenticity in medicine quite frequently. And it creates a barrier to healing oftentimes for the patients and for ourselves. And I just love that you brought up authenticity, because it's not something we talk about often enough in medicine, being authentic with people.
Yeah, I really feel like sometimes I was never trained in a way that I could say something to a patient like, I'm feeling confused right now about what you said, and then repeat it to them and say, is that what you said? Is that what you meant? Or saying something like, the interaction we just had made me feel sad. And I don't know how to take care of you in a non-biased way because I've been hurt by your actions. Let's talk about how we repair that or decide whether we want to repair that and go forward. And I don't have to do that very often, but occasionally, sometimes people don't like who I am, and that's okay. I'm sure there are better fits for people. I try to be Dr. Rosario, who is a pulmonologist, and I just absolutely loved him. I took critical care with him. Wrote on my evaluation that my greatest character trait was ability to discuss end of life discussions and have difficult discussions. And my greatest thing I needed to work on was the same thing.
Mm-hmm.
And what he meant was like, I had the courage to take it on, but I wasn't very eloquent when I was first there, when I was first developing conversations. And so sometimes we can say the same thing to lots of different people and it lands differently. Everything I say isn't going to land right. So I sometimes have to ask for grace. I have to apologize.
Yeah. So can I ask? Go ahead, Jeff. No, go ahead. Go ahead.
So it sounds like it's really important to you to maintain authenticity and stay in alignment. Do you think that's common in the medical profession, or how would you advise people or counsel people?
No, I think that from a very early age, we are trained to pretend like we know everything. And some of us, unfortunately, think we know everything. And if you're humble at all, you realize that the same advice we gave 10 years ago or 20 years ago is completely wrong now. I mean, there's that famous saying that 50% of what we learn in medical school will be wrong. And the unfortunate thing is we don't know what 50% is wrong and right. And I feel like we need to be humbled and be humble in ways so that we, Dr. Barch was one of our ethics professors, at Monument Health. It was Rapid City Regional at the time. And he sat on the ethics committee, and he was so great about calmly saying, well, let's think about this, and he would talk about paternity and autonomy and malfeasance and beneficence. And I was having that conversation the other day, and people didn't even understand what ethics was or why you need to balance paternity and autonomy. We are so paternalistic in medicine. And I feel like one of the really big downfalls of medicine is like, I know what's best for you. Well, that's interesting, because do you even know them? Because how would you know what's best for them if you don't even know who they are for real, for like the truth themselves, or what is their priority? Because one person's priority could be completely different than another one's. We often believe that somebody's priority is to live. Not live well, not live with quality, but like just live, just be alive. Well, you have to ask first and know what their priority is before you would ever know.
Yeah. We don't often dive into with patients often enough. What are they looking to create? What do they want out of their life? What are they looking for, right? Even though it's a big motivator for them to buy into what we want them to participate in, we don't take the time to learn.
What struck me on Dr. Mars's podcast, it was the podcast that he was a guest on, and I can't recall which one it was right now, but I listened to it, and I loved that you talked about during your timeouts before surgery, because I've been in the OR a little bit, I don't like the OR, but I was in there doing training. And it was mostly like identify the side, identify the patient, everybody take a moment, make sure you have the right, tools, and it's all these right things. But what you said during that podcast was, what were we doing for the patient? So the specific example you gave on that podcast was that person wanted to be able to dance at their daughter's wedding, right?
Yep.
The same can be applied for a glioblastoma, right? If we have a tumor that looks like a glioblastoma, it smells like a glioblastoma, the question is, do you need tissue? Should you get tissue? Does the patient know they might have a stroke when you get tissue? If the most important moment in their life is 2 weeks from then when their daughter is getting married, did you ask? Because if they're just told, like, we need to get this going to save you, are you going to save them? Save them from what? Save them for how long? And what disability are we likely to give them by saving them?
Yeah.
Boy, that's a big responsibility to carry.
Yeah, especially when we don't sit well with the unknown. The mystery of life and the mystery of death. We do not sit well with the mystery of death. We explain it away. We say that, we claim responsibility for good parts of it and don't claim responsibility for bad parts of it. But there's a whole mystery of life and death that we don't understand. Naomi Remen wrote about that in The Mysteries of Life and Death, I think is what it's called. It's a great book.
Wow.
When you're caring for a patient, do you ever get divine guidance or intuition? And if so, how do you balance that against the standard protocols of medicine?
Oh, that's a really great question. And as of like maybe 5 years ago, I probably would have answered that differently. One thing that has happened to me recently, and that was probably in the last 5 years, is that I realized that I was very happy that I went through med school and that I'm a doctor, but that I wasn't a doctor to treat diabetes, and I'm not really a doctor to treat hypertension. I can do both of those things. But I was placed here to really actually walk alongside people and to show them God's love, specifically Christ's love in me, meaning I represent him, so I better try to do it really well, right? I don't always do it very, very perfectly. But I had this very interesting thing happen to me. I had Padre Pio is a saint in the Catholic Church, and his prayer showed up on my phone, but my internet wasn't open. And I was like, that is really intriguing, you know?
Yeah.
And so I saved it just because I'm always interested in the saints. Well, then I was up in Rapid City going to Mass, and Justice Kern was up there, who's lovely, and my husband's a judge, and Justice Kern stopped me and asked me how my health was, and she said, I've been praying for you, and talked about the intercession of Padre Pio. And she sent me a relic from Padre Pio that had been touched to his foot, and a prayer that she had been saying for me. And it touched me really deeply. And the prayer is so specific for healing that what I realized is, you know, we in medicine are told, you know, to leave that part of medicine alone, but there's a whole group of patients that's very powerful for them. Right. And so one time a patient asked me, like, oh, I know you're not doing well, or you have this disease. Can I pray for you during their appointment? How powerful that they take time during their appointment. They said, can I pray for you? Can I pray over you? Can I pray with you? Mm-hmm. And so I did that. And I thought to myself, what if one of the aspects that people need from me, I'm not even offering because I've not been trained. I've been trained that I shouldn't offer it. Wow. And so I have been saying sometimes I've done, here are the medical things I want to do for you today. This is the medicine I want to prescribe, or these are the herbal medications I want you to take, or this is the activity I want you to do. This is what I want you to give up. This is maybe who I want you to forgive, because we've been talking about this now for 15 years and you still haven't forgiven them, and it's weighing heavily on you. And before you leave, you know, do you want me to pray with you? And do you know 100% of them have said, yeah, I would like you to do that. I would like you to pray with me. And so I have a very specific prayer to like, it's very specific about healing the parts of their tissue. And I will actually say, like, please take the glioblastoma out of this man's head. Please. And it also talks about, like, please give him, you know, the peace of mind. Please take the anxiety from him. And so I really feel like now part of who I am called to be is to just really be, I was here with people. I've always feel like I've made a really connection with people, but there's also a group of people that I make a very deep connection with. Mm-hmm. And sometimes people that I don't really take new patients in my practice, but there have been a couple of people that I felt were divinely sent. I met a woman at breakfast who had a tumor in her, and she said, I tried to get into you, but I couldn't. And I said, I'll see you this afternoon at 2:30 in the afternoon. And we got her, you know, set up for how she wanted to deal with it. But that has to be divine. That has to be divine when you're sitting somewhere and somebody energetically is like, I need to help this person. I try to listen for it. I try to be quiet enough to listen for it.
Wow. Quiet enough to hear the message. That's another form of presence.
It was. I was just thinking that. Another form of presence. Yeah, another form of presence. That's brilliant.
What are your thoughts, Corey?
Well, I was going to ask, you know, you grew up in a small community, right? Mm-hmm. You practice in a small community. How has that rural setting shaped the way that you show up for people in medicine?
Yeah. I was just talking with my friend outside before this podcast about that. And I just actually sent a message to Dr. Chow about how deeply appreciative I am that he's taking care of one of my favorite patients in the whole world. I know that other people don't have the same experience, but literally now in my world, I have taken care of a woman who is my mother's best friend, who's like 86, and her daughter who developed autoimmune disorders, but then infertility. We've helped her get pregnant. And those children have grown up, and then we've helped diagnose and treat cancer in one of them. That's like, it's mind blowing. Yeah. I usually go to the Edgemont Fair, and I used to pig wrestle. I can't pig wrestle anymore, but I used to walk there. And my brother-in-law was like, you're crazy. What are you doing? You're like out all night. And I'm like, yeah, I took like 48 hours and I stayed out till like 5:00 in the morning. And I just literally was sitting at a table. Everybody's dancing. Everybody's having a great time. There were so many people that came up and told me how our lives had intertwined for like 20 years.
Wow.
Sometimes I knew the impact. Sometimes I remembered exactly the story, but sometimes I didn't actually know that person was sitting in the room when I gave the death diagnosis or sat with somebody during dying process, and they just came up and they said, I remember this about you. It's so powerful and scary in the same time to realize what a deep impact you can have for good or for bad. That's the scary thing, right? What if I wasn't present? And what if I wasn't intentional? And I'm sure there are moments I have not been intentional.
Yeah.
You so deeply impact people that it is a life calling to do that. It really is a life calling to do that. And so special that I've gotten to live this life that is so wonderful and magnificent and fulfilling in that realm. It's just incredible. I just feel so blessed.
That's beautiful.
That is. Yeah.
Do you have an intentional way of being when you're with the patient for the first time?
I don't know that I do. I have moments sometimes when I have to do things a little differently. For example, I think I told you that sometimes people come into my life and I know that there is something I need to unwind with them, and I know that it's going to be bigger, I guess is what I would call it. So like, for example, I put somebody onto my schedule for a longer period of time. I don't usually do hour-long consultations because I usually can't. But that morning I knew that I needed to do that. I had added her to the morning. And when I came into the room, I said, I want you to know we have a full hour to sit here and talk. This is not rushed. I am not in a hurry. You do not need to worry about that. So I want you to tell me your story. I'm not going to interrupt you for the first 7 minutes. By the way, 7 minutes is an incredibly long time to talk, just with no interruptions. The acknowledgement, I hear you, but not like, oh, that.
Yeah.
Right.
How amazing. Where does somebody go, right? Tell me your story. Imagine what your story would be. Imagine what my story would be. Where do you start? You know? And so that's the first thing I like to do. I didn't used to take like histories about who are you?
Right.
How are you feeling? Does this make you feel vulnerable? If I was to choose how to do something, and I have to be careful because of various rules, right? If I was to choose how to do something, it would be to offer somebody something to drink, and I would actually sit there with a cup of coffee and visit with them, right? Because it's through that discussion I can really determine how to care for them.
Yeah.
In the emergency department, I've had to give, and in the clinic, I've had to give really bad news to people. And one of the techniques that I heard somebody talk about that I applied to medicine was that people, if they can move their bodies, they can move their energy through their bodies and they can digest things better. And so one of the things that recently I've been doing is coming to people and saying, you know, I got your results and I do have some bad news for you that I want to share. Would you like me to share that here? Or would you like to take a walk and share that? We can go out in the garden, or we can walk around the garden area. And almost everybody wants to receive that information walking outside where they can breathe and they don't feel like they're going to collapse. And, you know, when they get that impact of this, like cancer diagnosis or something, you can stop and be quiet with them. And so I've given people information now in different ways. I will actually do some of my visits are in the garden. I actually just go to the garden and meet with my patients and talk. If I don't have to do or sometimes I'll go out to the garden and talk and then come in and do a physical exam. So I really enjoy doing that type of being. I think that answered the question, but I'm not sure. I get excited.
That was a brilliant answer. I love it.
It was.
Earlier, you said when you're with a patient and you said, okay, what I'd like you to do is forgive so-and-so. It's been a 15-year lack of forgiveness that's been weighing heavily on you. Tell us about the value, the power, the miracles in forgiveness.
Yeah. Yeah, you know, I think that our bodies hold on to so many things. They hold on to trauma from our childhood. I think that term is somewhat loosely use nowadays, but they hold on to things that we can't possibly understand. It reminds me of another story. I'm going to come back to the forgiveness, but I was talking with a woman yesterday about a spontaneous dissection of her coronary artery when she was in her 40s. Shouldn't happen, have trauma. But what she did have, when somebody asked the deeper question, and I happened to be caring for her, but is a domestic violence situation. And it was more emotional abuse than anything else. Those things weigh so heavily, they are stuck in our bodies, right? Bessel van der Kolk wrote a book called The Body Keeps the Score.
Right.
And the body keeps the score of these things. So when we hold on to things, anger, and when we hold on to events and things and we don't choose to forgive, it actually it's just like poison. It poisons us. And I went over to Canyon Ranch over in I went to Massachusetts, but there's a Canyon Ranch in Arizona too. And it happened to be during COVID. They hadn't shut down, but they had very few participants. And so it was supposed to be a class of 50 or 60, but it was just me. And there's this like world-renowned instructor on a labyrinth. And he said, well, it's just you. So what do you want to learn? What do you want to work on? And I said, I want to learn how to work with a patient who has a heavy forgiveness and work with the physical walking the labyrinth. So he trained me how to like talk with them about first setting an intention for the forgiveness, reviewing what could be heavy on their heart or heavy on their mind, and meditating upon that as we went through the labyrinth, letting go of it in the labyrinth, in the center of the labyrinth, and then feeling the release of it as you walk out of the labyrinth. And I was thinking of this the other day as I was working with a woman that was that just freely shared with me that she has been having a very difficult time forgiving herself for an abortion she had. And I said, you know, we need to be able to assimilate and work through this. So everybody forgives in a different way, and forgives himself. So some of this is self-forgiveness, right? It's not just forgiving someone else. And I thought one of my future projects that's on the docket is a labyrinth, because I feel like that could be a very powerful thing for us to help people, or for people to go to themselves if they understand it.
Wow, brilliant.
That's great. I love that.
Thoughts on that, Corey?
Well, I love that. I mean, I love the idea of the movement and the kind of walking through and releasing it, and really just the forgiveness and self-forgiveness is vital to kind of creating our future selves and creating who we want to be in the world. And so I love the idea of creating that and you doing that. So I would love to be a part of that.
Yeah, I really hope I know I can get it done. I just need to. I have a lot of little projects that I'm doing. Yeah. So this is my 52nd year of life. This would have been the year that my mom passed away. Oh, wow. And so this year has been celebratory in a lot of ways, that I know that there were some things she wanted to get to that she didn't get to. And so I've taken some time with my family. I've done some projects in my home garden. I have intentionally set a list of people that I wanted to visit with, that I spent time with. So next year, maybe I'll start working on the labyrinth.
Yeah, that's awesome. I do have you talked about your colleagues, right? Physicians, folks that you've worked with, talked heavily about the interactions of how you're being with your patients. Tell us a little bit about how you're showing up and your way of being with your team, with the nurses, with the staff. Tell us a little bit about that.
Yeah, I really believe strongly in work-life integration rather than work-life balance. Like, I don't drop who I am and go to work, and I'm one person at work and then I'm one person at home, right?
Right.
Like that authentic me needs to show up for my patients, as well as Jamie and Kaylee and Dr. Mona Saini, who's one of my besties that's like in my pod area. Also, like, I try really hard. It's very easy locally with administration, because I love my administration locally. But also those conversations, those higher level conversations, trying to show up. So what that means is I know my nurses' children's names. I know my nurses' birth dates. I know my nurses, what they're going through, if their husband loses a job, or if they're, if they're struggling with their marriage. It doesn't mean I need to get into like some people may say, not to get in the weeds. It doesn't mean that you have to be unprofessional about it. But I show up for them in a way that is, maybe some people wouldn't consider it professional. I don't actually know. We aren't really we are a team of hearts and minds together. I can't even take care of my patients unless Jamie and Kayla were with me. I really couldn't do it. They are my team. They are integral to how I work. They are part of my brain. They are part of my heart. They know how to treat patients because that's who they were, and that's who I was, and that's why we came together.
Yeah.
And we believe, that we will see somebody in the community that we know has a need, and we get them in, or we get them arranged. I also think that, there are times when in meetings I would have been very frustrated and I might have said something not very nice. And now I will pause and think, is it going to actually help? Is it kind? Is there a better way to say it that will still land and be authentic? I don't sugarcoat. I'm not very good at that. And I'm definitely still authentic even in meetings, but is there a way that gets my message through that isn't nasty or mean-spirited, know? And I think that is some of the ways I show up. I try to show up physically with food because I think that when we break communion together, it's very important. That I feel like that is actually completely underestimated, food and water. Yeah. So we recruit a lot of physicians out of my home here. And my daughters are so wonderful at helping me. They'll put the meal together. It's usually something that I've created, but they're usually setting the table. And we have it's not a show off place. It's actually just beautiful because it's my spirit and my welcoming, right? Yeah. It's not about what I have, it's about what it is. And so we bring physicians in and see if they like our team, we're all friends. Like the other day we did this article and I'm really excited for it to come out in Down Country Roads because it's our team members. It's the 10 of us like hanging out together. We took some photos and it's really like, if there's a problem, we'll pick up the phone and call somebody and be like, are you doing okay? Do you need some help? We had a really bad rally. We were up 35% in Custer for the rally. And we don't have surgeons locally. It's us in the ER, it's us in the clinic. Yeah. And so our new physician, is there putting chest tubes in and intubating people, and it's scary and it's big. And but yet the other physician was right alongside them. Yeah. And after the day is done, I called and said, are you okay? Like, do you need to talk? You doing okay? And I think that's how you show up for people is actually physically showing up, mentally showing up.
Yeah. That's wonderful. Thank you for sharing that.
Yeah.
All right. So if we gave you a magic wand, you could redesign the healthcare system in America, what would you change or what would you do?
I think back to how profound my education was at Rapid City. And I had some of like the most wonderful mentors, John Luby was my internal medicine doctor. Dr. Vogely was my GI doctor. Dr. Rosario and Dr. Rawson were my critical care specialists. And I was not either the brightest or the best med student or resident. I didn't know the most. I didn't get the best scores on my boards, none of that stuff. And they couldn't help me as much with the things that we're talking about. Dr. Vogely certainly could, probably Rosario could. But they were so smart and they were so interested. Mm-hmm. So a magic wand would definitely include curiosity towards who that person is, curiosity towards a disease state, curiosity towards what their function was before they were in your office and how to get them back to it. Because I feel like we're so overwhelmed right now, we're missing the curiosity part, the passion part. I would slow things down a little bit. I would try to get more time in clinicians' hands with patients. And I know that it sounds just flowery, but I would just bring a love and passion back. I think love and kindness just
Mhm.
has to be at the forefront of this.
From a short-term thinker's perspective, a lot of that stuff sounds like it's going to take time. It's going to cost money. It's going to take you away from seeing patients. You won't be able to see as many patients in a day, put the same numbers on the books. But from a longer view, it would occur to me that that would produce a better sense of wellness and higher degree of patients buying in and seeing themselves as the captain of their own teams, taking care of themselves. And I think overall it would reduce costs to the society in medicine if we could come from that place that you've described.
I absolutely agree with you, Dr. Mars. I think that if we empower patients, it's one of the biggest mistakes that we do to say, like, just put your care in our hands. People shouldn't just put their care in their hands. They should know that we're experts in certain parts of their life, that we're going to do the best surgery, but they should be empowered to research. They should be empowered to know their own bodies. They should be empowered to use their own voices. And I think that that would make their healthcare so much better. I grew up in an area where we were very self-sufficient. When you come from a ranch, there's any number of things that could kill you in a day, driving too fast or getting bit by a snake, or there are so many risk factors being on a ranch. So, and we were, 70 miles from Chadron would have been the closest physician. So there were times when we had injuries or we had events that you had to figure it out. Like, okay, it really hurts bad enough to drive 70 miles, bad enough to stop all of the hay equipment and all of the day and everybody get in the car and go. Because if we get there and it's not that big a deal, you're going to be in trouble, actually, because we've slowed the health. So I think empowerment of, like, how sick are you?
Yeah.
There are people that now, especially with my chart, it's like a texting, like they're texting their doctor back and forth. And I think that's a mistake, to get into a situation where little things take up a lot of time and a lot of energy. I was listening to a thing, and I'm going to get this wrong. I wish I had this right. But they were talking about really high functioning individuals, and they talked about Steve Jobs and Elon Musk. And they were talking about the ratio of noise. And then they used another term, which is like the real stuff. I can't remember what that term was. But they talk about how really high functioning people don't tolerate the noise well. And not physical noise, but like the minutia, the bullshit. They're like, don't care. I don't care about the chart. Actually, I know that the note needs to be done, but I don't care about all the regs. Somebody else can do that, but somebody else can't do the job that I'm doing. So I need somebody else to take care of all the noise so I can focus on the patient. And the patients need to not focus on too much noise either. We in primary care, I don't know about you guys, but we have these ridiculous, we've gone from just seeing a patient when the patient wanted to be seen, right? The patient called and they said, I need to be seen. And you're like, okay, we'll get you in for an appointment. To now, it's almost like a medical industrial complex where it's like, well, in order to be seen for surgery, you need this pre-op 30 days before, even though you were just seen. And after your hospitalization, even though you're doing well, you need to be seen within 7 days, even though your doctor could just call you and be like, you doing better? Did you take the antibiotics? There's so much like extra stuff that I feel like we don't really need to do, but now it's been mandated, and that needs to be fixed. We don't have enough money for that. First of all, it's one thing if it really helped the patient, but if it's just, don't you feel like sometimes you see these people and they're just going to appointment after appointment after appointment, but nobody's actually fixing the problem?
Yes.
I'm just
very much.
And sometimes people get a little irritated with me because, like, I'll say, like, you don't need to see cardiology and you don't need to see endocrinology for this. I'm going to take care of all of it. If it gets to more than I can handle, I'll get them involved. If you feel comfortable with that, and the patient's like, I feel comfortable with that, I don't want to go to all these doctor appointments.
Right.
But we need primary care to step up and have enough time to do the cognitive load of cardiologist, endocrinologist, and a Medicare wellness at the same time.
Brilliant. Apply the most valuable resources where they'll do the most good.
Exactly.
What do you think, Corey?
Yeah, I would agree with that totally. Is giving people enough time and space to do that work and to get rid of all the noise. We have a lot of noise. So I hear that very much so. Question for you. Earlier on, you touched on it, right? We're all going to expire at some point, right, in our lives, and we're going to get there. And we all become patients at some point too, right? We all become a patient at some point. So how has your role in being a physician in that sense and who you are, how does that help you show up as a patient, or have you been a patient in that way that gives you that way to show up differently?
This is the first time anybody's asked me this question. And because I haven't had to rehearse it, I hope to answer it well. And I hope that the audience understands how I'm saying this. Okay.
Yeah.
My experience with the medical community was very negative. I was pre-nursing and I went into med school from nursing school because I saw my mom treated so poorly in the medical field that I absolutely could not stand by and not go to medical school and know that the people I interacted with would not have that experience. She was like the most beautiful woman, and she was so kind, and she was diminutive, and she was not hostile. So that didn't actually end up good for her because she didn't know how to advocate for herself. And because we were a ranch family and because we were taught to be polite, we didn't actually understand how to advocate for her. So unfortunately, that ended up that she was triaged to a non-urgent side, and then she got admitted, but she had E. coli sepsis, and she then was on an understaffed floor, and she threw up and choked to death on her own vomit. So that was my background with the medical community, right? So what that creates in me is like, I am exceptionally scared of physicians. And I've chosen, like my physician, Dr. Saini, who I chose, now is moving to the emergency department, and it makes me anxious and nervous because I want to be in charge of my healthcare. And I don't do traditional healthcare well. So my oldest sister, she does traditional. She is a physician, and she is a classic physician. Most physicians want to be treated to the nth degree. They want to go to Mayo Clinic. They want all the best people. They want all the best tests. They want all the best labs, everything. The particular disease that I have really doesn't have a lot that you can do about it. It's polycystic kidney and liver disease. And I actually want to be able to be seen as a person that is an individual and lean into the unknowing of that disease and not be the disease. I don't want to be told that I'm going to need to do labs, for example. Like if I know that my creatinine is doing this, but we don't do dialysis until here anyway, can't I just see how I'm feeling, for example? If I'm taking an antihypertensive, and my blood pressures are controlled, do I need to measure how big my kidneys are? Guess what? They're huge. I know. I feel them every day of my life. I don't need to look each year and see that they're bigger because I know they're getting bigger. So if I had multiple sclerosis, I don't need to actually look at an MRI to see how I'm doing. Is my leg working? Am I peeing my pants? I can see why some people do it to change medical management. I'm not saying that. I do think that's important if you're changing medical management. But if you're simply going in and just ordering a boatload of tests and saying, good, great, I'll see you in 6 months. I want the opportunity to say, I'm good. I am going on a pilgrimage to ask for healing. I meditate. I deeply lean into my spiritual faith. I take my losartan. I take my garlic. I take bergamot. I do qigong, or I try to. I'm not very good at it. I do massage, and I do lymph massage, and I want the ability to, but if I was to tell a physician that, you can just forget all the holistic stuff. They wouldn't be impressed at all. And they wouldn't even understand it. But yet I feel like that's integral to my wellness.
Right.
And so I had seen Dr. Ogunrami as a nephrologist. I hope he'll still be my nephrologist because I don't go in very often. But he's so kind. He listens so well. He cares about who I am, and he isn't paternalistic. And I really hope that as the future of medicine goes, I can continue to find someone like that. I'm very concerned that if I need a transplant, the transplant process is like, hey, like you either do this or get out. Like you don't get it. If
Right.
you won't take all these vaccinations, you don't get a transplant. That really deeply concerns me.
Right.
Wow. Well, thank you for sharing that. I appreciate, and you did it. It was great. I love. You didn't rehearse it, and it was perfect.
Yeah, when you do something like this, as you guys know, you know that you're going to get some lovers and you'll get some haters, and it's.
Yeah.
I wouldn't say it's hard to put yourself out there, but it is hard to make yourself vulnerable where there's lots of people that will criticize. But people get to live their life, and I get to choose and live my life.
Absolutely.
I
Absolutely.
had a hard time with the word vulnerable for a long time, and Corey's helped me work through that. And ultimately, I've come to the definition that I learned from Devin Banison, that it's authentic truth telling.
Yeah.
There's nothing wrong with authentic truth telling.
Absolutely.
I like that.
What you shared gives me some insight into how I've experienced you, which is that you are a strong advocate for your patients. You take care of your patients immaculately with a broad spectrum and a deep stroke. And when you do send a patient out, like, you're going to call, you're going to say, hey, did you take good care of my patient? I want to know what's going on. And I love that. So thank you for that.
Yeah.
I really appreciate the care you've given my patients. And I mean, I really think you're an excellent physician. So I really appreciate that. It's one of the things that is anxiety producing is losing, as I get older, losing my reliable resources.
Yeah. Well, I want to acknowledge you for just demonstrating exactly what being in medicine was intended to talk about. I mean, it was just, I really appreciate you being on and sharing your world with us, because that is exactly what we envisioned this podcast being and talking about. So thank you.
Well, thank you. I really admire what you guys are doing. And I think that the medicine is changing slowly, but it is surely changing, because there's so many of us that have this deep desire to want to take care of people. And we're not willing to accept medicine exactly as it is right now.
Absolutely.
Thank you. It's been brilliant. Appreciate you.